Welcome to Anatomy in Nutshell. In this video, we are going to see the anatomical aspects of uterus and various ligaments and supports of uterus. The uterus, otherwise called Hystera or womb. The uterus is a childbearing organ situated in the true pelvis. It's a hollow, thick-walled and firm organ. It gives protection and nutrition to the fertilized ovum. The shape is pyriform. The length is about 7.5 cm. Breadth is about 5 cm. 2.5 cm is thickness. And the parts are fundus, body and cervix. The uterine position. It has anteversion and anteflexion. The anteversion is nothing but the angle between the long axis of the uterus with the long axis of the vagina. It's about 90 degree. The anteflexion is about 125 degree between the long axis of the body and cervix. The anteversion is maintained by a couple of ligaments. They are called uterosacral ligament and the round ligament of the uterus. It helps to prevent the uterine prolapse. The first picture showing the anteverted uterus. The second picture showing the retroverted uterus. The retroverted uterus is more prone for first trimester abortion. The next we are going to see the fundus of the uterus. The part of the uterus above the level of the uterine tube opening is called fundus. It's the upper free end of the uterus. It is convex and covered by peritoneum. Directed forwards, the implantation occurs in the posterior wall of the fundus. Coming to the cornua of the uterus, it has two ligaments attachment. The ligament of ovary and the round ligament of the uterus. The ligament of ovary extends from the ovary to the lateral end, that is cornua. Coming to the surfaces of the body of the uterus, it consists of anterior and posterior surfaces and two lateral borders. The anterior surface, otherwise called vesical surface, because it is related to the urinary bladder. The posterior surface, otherwise called intestinal surface, it's related to the rectum and form the recto-uterine pouch, otherwise called pouch of Douglas. In case of any pathology in the pelvis, the fluid collection present in the pouch of Douglas or cul-de-sac. Coming to the lateral borders, it provides attachment to the broad ligament of uterus. The uterine tube opens at the upper end. The attachment of the round ligament of uterus and ligament of ovary at the cornua. The uterine artery ascends in the lateral border. The cavity of the uterus is triangular in shape in coronal section. It communicates with the uterine tube in the upper part and vagina with the lower end. Coming to the cervix of the uterus, it's a lower cylindrical part, less mobile than the body of the uterus. It has 2.5 cm length, projects into the anterior wall of the vagina. It has two parts, supravaginal part and the vaginal part. The supravaginal part anteriorly related to the bladder. Posteriorly, it forms a recto-uterine pouch. On either side, is related to ureter, uterine artery and parametrium. Coming to the vaginal part, it has four vaginal fornices, anterior, posterior and two lateral fornices. Coming to the external os, it is circular in the nulliparous and transverse slit in the multiparous woman. Coming to the cervical canal, it is fusiform in shape. It extends from the internal os to the external os. The anterior and posterior walls in contact with each other. It has the mucosal folds. They are called orbae vitae uteri. The blood supply of the uterus from the uterine artery, ovarian artery and the vaginal arteries. They form the anterior and posterior arcuate arteries which run in the myometrial layer. The uterine artery is a branch of the antedivision of the internal iliac artery. It has tortuous course, crosses the ureter 2 cm lateral to the cervix. It is an important surgical landmark. Coming to the ovarian artery, it arises from the abdominal aorta. It passes through it supplies the ovary through the suspensory ligament of the ovary. They form the radial branches. From the radial branches, the basal layer, spiral branches which supplies the superficial two layers of the uterus, and they form the vein. The vein drains into the internal iliac vein. The ovarian vein on the right side drains into the IVC, on the left side drains into the left renal vein. Coming to the nerve supply of the uterus, the sympathetic branches from the T12 and L1. They help in the uterine contraction and the vasoconstriction. The parasympathetic fibers from S2, S3 and S4, they produce the uterine inhibition and the vasodilatation. These nerves reaches the uterus through the inferior hypogastric, ovarian and the uterovaginal plexus. Pain from the cervix via the parasympathetic fibers, the other parts of the body through the sympathetic fibers. It is an important MCQ. Coming to the lymphatics of the uterus, the upper part of the uterus, there is fundus in the upper part of the body, drains to the lateral aortic group of lymph nodes. The lower part of the body drains into the external iliac group of lymph nodes. The cervix drains into the sacral and the internal iliac group of lymph nodes. I think this is a more lengthy video. We will see the ligaments, supports of uterus and the applied aspects of the uterus in the second part of the video. Subscribe Anatomy in Nutshell for more MCQ videos and anatomy related topics. Thank you.